It's Tuesday, November 9th, and the time for your Barbados Today morning news update. Healthcare institutions across Barbados have started preparations for the rollout of the COVID-19 safe zones designed to stem the spread of the virus. But while the amended Emergency Management COVID-19 order, published on Saturday in the Official Gazette, paved the way for the safe zones to be implemented from Monday, the acting Chief Medical Officer, Dr. Anton Best, revealed that the zones would not actually operate immediately. Emmanuel Joseph has the story.
Dr. Best said the date for the rollout was a policy decision which would have to be addressed by Minister of Health and Wellness, Lieutenant Colonel Jeffrey Bostick. He said that on Monday, the various health institutions started preparations in order to facilitate the actual functioning of the zones when the time was right.
There's no first day of safe zones per se. I mean to say that we were going to start today with everything. The facilities are still getting themselves ready and being sensitized and all of that.
Meanwhile, the Queen Elizabeth Hospital, the country's main healthcare facility, has started preparations involving the various institutions and labor unions. Executive Chairman of the QEH, Juliet Bino Sutherland, said the board met Sunday night and on Monday, the management team examined the new directive for the establishment of the safe zones.
Like all the other healthcare institutions, we're making preparations, and we have done consultations with the Barbados Nurses Association, with the National Union of Public Workers, with the Barbados Association of Medical Practitioners, and we're due to speak to Barbados Workers Union this coming Wednesday at 10 a.m. So and then once we finish our trade union consultation, then we'll do our staff sensitization. We thought it is important to hear from your trade union partners, so we prioritize those consultations, and those consultations help us shape our implementation plan.
She also assured Barbadians that the QEH was open to all residents who are seeking medical attention. The executive head was responding to claims circulating on social media that the hospital was only seeing patients who are vaccinated.
What we need to give the assurance that the hospital is open to all Barbadians. We are funded by taxpayers' dollars. So whether you're vaccinated or unvaccinated, the hospital is a space that welcomes people who need the care.
Emmanuel Joseph for Barbados Today.
Meanwhile, Barbados' largest public sector trade union is considering its next course of action to address the impact the new COVID-19 safe zones will have on its members in the healthcare profession. In addition, Acting General Secretary of the National Union of Public Workers, Richard Green, says the union was disappointed at not being formally consulted on the implementation of the zones, which he says will change the terms and conditions of employment for the healthcare providers.
We now have to look at the courses of action that we will have to employ to address whatever areas of concerns that the workers in the health sector will have with it now. It's a little premature to say what action. It's probably more along the lines of discussion and consultation and some representation on any fallout.
Green says the union will now speak to its members to see the specific areas that affect them and how they would seek some redress if they feel violated by the conditions of the safe zone.
What the safe zone is doing is it has altered the terms and conditions of employment of the workers in the healthcare sector, and in effect mandating the workers to take the vaccine and to have compulsory testing.
The Barbados Workers Union welcomes the implementation of mobile lunchrooms and sanitary facilities for agricultural workers. BWU Deputy General Secretary Dwayne Paul said the union has for many years been asking for such facilities to be provided. He said that the project is one of the new benchmarks in agriculture.
I believe that the facility represents the beginning of what we believe should be the new standard for agriculture, not only in the public estates but also in the private estates. And the union will continue to agitate for such changes. The only disappointment that we have obviously is the time it took to get us to this stage. We saw earlier the facilities that were issued to workers before, which was the reconfigured buses that was used to provide shelter in the fields. And between that decision and this one, there's a span of almost 20 years. And that's unfortunate. But nonetheless, we are very pleased of where we've reached today. And we intend to make sure that this remains the standard. So in addition to the delivery of the additional facilities, which the CEO knows very well that I'll be checking in to ensure that we are on stream to meet that December delivery, that we also will want to hear about the robust maintenance plan to ensure that these facilities are maintained and kept to the standards that the workers deserve and should have been enjoying from the inception.
There's regional and international news after this short break.
Hi, my name is Michelle Thompson. I'm a visually impaired person. I am also a member of the National United Society of the Blind of Barbados. I am vaccinated. I took the vaccination due to the fact that I am diabetic, I'm asthmatic, and I also have high blood pressure. I had no side effects. Everything went calm and smooth, as my doctor said it would go. Please, people, go ahead and do the right thing.
Let's roll up our sleeves and get back to living.
To news from the region, experts warn that Guyana needs to find urgent solutions to address mental health related issues. Gordon Mosley of News Source Guyana has that report.
Guyana's suicide rate remains high, and the country is currently ranked at number 2 in the world when it comes to the global suicide rate. The issue came under sharp focus this morning at the launching of the Guyana Mental Health and Wellbeing Conference. During the opening, the director of the Global Psychiatric Epidemiology Group and Columbia University professor Dr. Christina Hoven said there is an urgent need for solutions to be found to Guyana's mental health situation. Dr. Hoven is part of a team conducting a study in Guyana on suicide with the hope of coming up with solutions that could aid in stemming the high rate of cases. According to Dr. Hoven, while efforts have been made to address Guyana's suicide problem, progress has not been good.
It doesn't matter how you look at it. Guyana doesn't look good when it comes to suicide or activities related to suicide.
The professor called for more understanding of the issues surrounding suicide if there could be true change.
So when we talk about what can we do a lot of things. And we can do it from a multifaceted perspective because suicide is multifaceted.
And finally, visitors boarding to the United States on Monday after the country reopened its borders to vaccinated persons. The travel limitations, which were imposed in March 2020, have affected non-US citizens from over 30 countries, including the UK and EU.
Monday morning, British Airways and Virgin Atlantic took off simultaneously from London en route to New York as part of celebrations marking the end of US COVID restrictions in place since March of 2020. Now, nationals from 33 countries can come to the States for non-essential travel so long as they are vaccinated and provide a negative COVID test within 3 days of departure. Those under 18 need only a negative test result.
It's been an amazing day for the team.
Jose Freg with American Airlines tells CBS News demand for flights is up 74% from Brazil and 66% from the UK within the past few months.
The pent-up demand is there. Customers have been, chopping at the bit to come here, and we're really excited that we can now transfer customers from these countries into the U.S.
Travel from Canada and Mexico also resumed overnight, leading to long lines on the northern and southern U.S. borders.
That's news. But for the very latest, visit us at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media in bus terminals, as well as screenplay at supermarkets and gas stations near you. And you can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.